The Halton Region Health Department is reporting a confirmed case of the measles over the weekend. The Halton-based resident is a male in his 30s.
While he's a Halton resident, during the time that he would have been infectious with the disease, he actually spent no time in Halton Region. So we have been in touch and working very closely with the other regions where he was to make sure that where he was, if people were potentially exposed to him during that time when he was infectious, they are being identified and notified.
The measles is a highly contagious disease that takes up to 21 days for someone to get the symptoms. It's also difficult to control, as it is an airborne virus and can linger for up to 2 hours after its host has left.
That means you can start off with something that looks like the common cold, with fever, with runny nose, with cough, along with possibly red eyes or conjunctivitis. That's followed within a few days by a rash. The rash often starts at the head level or the face, and then it travels down the body, and that's very characteristic of measles. So if you are sick, what I would tell people is that encourage them to stay at home, call their healthcare providers in advance of seeking medical attention if they suspect that they have the measles.
Measles is the leading cause of death to children under the age of 5 worldwide. It also affects pregnant women and people with weakened immune systems if they have not been vaccinated. But thankfully here in Canada, the immunization is free of charge, and healthcare workers urge everyone to update their vaccines as soon as possible.
So what we know of our previous outbreaks in Ontario is that they've either been directly or indirectly linked to travel outside of Canada. So we know that our immunization rates, and we're working very hard to keep them up, are fairly good. But in a lot of other countries, the immunization rates for measles are poor. And so it is circulating in other parts of the world. And because of the world that we live in, there's a lot of travel outside of Canada. So we are seeing sporadic cases that come back into Canada for those individuals who are either unimmunized or under-immunized.
Those born before the 1970s are assumed to be immune to the virus after it was a pandemic. But for those born after, you need to ensure 2 doses have been registered to give you full immunity.
It's 2 doses that will provide you with close to 100% immunity, and the science is very clear and indisputable in terms of the vaccine being safe and effective.
For more information on upcoming immunization clinics or on the measles, you can dial 311 or call the Halton Regional Health Department at 905-825-6000. You can also visit halton.ca/measles. For Halton Insider, I'm Kristen Demeny.